This video is on infection control, assessment, and response tools. What is an ICAR? The basic elements of an infection prevention program are designed to prevent the spread of infection in healthcare settings. When these elements are present and practiced consistently, the risk of infection among patients and residents and healthcare personnel is reduced. The infection control assessment tools were developed by the CDC to assist health departments in assessing infection prevention practices and guide quality improvement activities by addressing identified gaps. These tools may also be used by healthcare facilities to conduct internal quality audits. Here is the landing page for the CDC infection control assessment tools. The link is provided on the slide. The objective of today's webinar is to provide education for local health departments on how to complete an ICAR. The goals of the training include developing partnerships with local health departments, engaging local health departments in HAI prevention work, expanding the scope of services for local health departments to include the ICAR assessments, and increase knowledge of local health departments about the long-term care facilities in their respective county. The CDC has developed an ICAR tool for several healthcare settings: acute care, outpatient, long-term care, and dialysis centers. Recently, however, the CDC combined the tools to create one version with 10 separate modules for assessing infection prevention practices and quality improvement activities. The CDC website link is provided below. Before we begin, let's start with some acronyms and looking at the definitions. ICAR stands for Infection Control Assessment and Response. IP is your infection preventionist. Healthcare personnel competency, the proven ability to apply essential skills, knowledge, and abilities to prevent the transmission of pathogens during the provision of care. Competency-based training, the provision of job-specific education, training, and assessment to ensure the healthcare personnel possess infection prevention competency. Competency assessment, it's the verification of competency using knowledge-based testing and direct observation. If direct observation is not included in a competency assessment, an alternative method to ensure healthcare personnel possess the essential knowledge and skills and ability should be used. Audits is the direct observation and monitoring of healthcare personnel, its adherence to job-specific measures. Feedback, it's a summary of audit findings that is used to target performance improvement. Local health departments may reach out to facilities within their respective county to schedule an ICAR to gain a better understanding of the facility and its infection prevention program structure. When the facility has had or is currently in an outbreak, local health department is helping the facility work through an issue. That might be a great opportunity or great time to go in and complete an ICAR. The facility is not reporting as required, and the local health department feels the need to investigate further. Or perhaps the facility has reported extensively drug-resistant organisms and other multi-drug resistant organisms, and the local health department is wanting to, again, get a better understanding of infection prevention practices within the building to hopefully, or to get a gain understanding to make sure that there is not transmission occurring within the building. So let's actually look at the CDC tool. Section 1 is demographics. This is a separate document. It's created to capture basic information about a facility before an ICAR is actually performed. So what you would do would be send this to a facility, ask them to complete it and return it before the day of your visit so that you've had a chance to review whatever they had put down. It's going to ask questions about the size of the building, the licensed beds, and the current census. What type of room design? How many single or private rooms do they have? How many double, triple, and perhaps even quads? What services are provided within the building? Do they take ventilators, etc.? What type of disinfectants are being used? And whether there is access to a trained infection preventionist in the building? What's their current policy review practice look like? And what type of education is provided to families and residents? The ICAR includes 10 separate modules. There is one on training and audits, hand hygiene, transmission-based precautions, environmental services, high-level disinfection and sterilization, injection safety, point-of-care testing, wound care, healthcare laundry, and antibiotic stewardship. The copy you will use is called a facilitator guide. So what the module's design? The facilitator guide provides the questions in column 1, the rationale and the relevant guidance in the middle column, and a section for the notes and your comments in the 3rd column. Each module is laid out exactly the same. So the design is the same. If you are unsure how a question should be answered, refer to that middle column for the rationale, and that'll give you a better understanding of what they should be responding or how a facility should be responding. So what does workflow look like? You're not going to have to complete all 10 modules. Not all questions need to be asked. You're going to determine what modules to complete based upon review of the facility demographic document, any reported data, and any other concerns that you might have. Now, it could be a concern at the facility level. They're asking you to come in, and these are the certain things that they'd like you to look at. Or it might be concern on your end that maybe they're not reporting, or that there's been an increased number of cases, and you want to go in and look at their infection control practices. So whatever, that could be either or in that situation. A standardized approach is to complete the following modules: training and audits, hand hygiene, transmission-based precautions, environmental services, point-of-care testing, and wound care. Now, the other modules can be added to address an area of concern or when it applies to a specific facility. For example, these are the modules that we use at most of our long-term care facility ICARs. However, if you're going to an LTAC, a long-term care, acute care hospital, then perhaps they're doing, and they probably are doing, high-level disinfection and sterilization within that building. You're going to want to pull that module in and begin to ask the questions there, just to make sure that they are doing appropriate steps in their practices related to high-level disinfection and sterilization. So getting started. Review reported XDRO and MDRO data in the county and at the facility level. Is there one building that has more XDROs or MDROs than another? You know, you might question, why is that? Maybe it's their reference or who they're getting their patients from, et cetera. But anyway, just a better understanding of what's going on in the county, and then try to get down to the facility level just to gain a better understanding of what's happening in the county. And then call the facilities. You might start with those that have reported the XDROs and the MDROs, or those that you have concern with, and schedule an appointment to go on site to conduct an ICAR assessment. Remote can be done, but on-site is preferred because they can tell you anything over the phone, but when you lay your eyes on it and actually see practice being performed, you get a much better picture of what's going on in the facility. So how do you actually conduct the ICAR? You're going to ask the questions using the ICAR modules as your guide. You're going to tour the facility, take notes as you go, observe hand hygiene, personal protective equipment use as you're out touring. At the end, you're going to create a summary report using your notes, the responses to the ICAR questions, and any observations you captured, and then send that report to the facility. Determine if an action plan is warranted based upon the gaps identified. And if feasible and based on the findings, consider following up with the facility at a minimum of 30, 60, and 90 days post-ICAR. You can, but you aren't required to do an interview type session. This is where you would go in and perhaps you're going to meet in the conference room and you're going to sit down with the modules that you're going to look at and you're going to ask the questions, they're going to respond, you're going to fill out the form, etc. So that's what I call the interview type sessions. But you may find it easier to actually tour the facility and ask the questions as you walk along and observe practice. The way you conduct an ICAR is going to probably vary over time. You might start out one way, which would be the interviewing and then touring the buildings. But as you become more comfortable with the tool and the facility, you might tour and observe practices and ask questions as you go. The questions are going to naturally flow because you're used to the tool by now and the facility. So let's get started. First of all, I want to say good luck. Reach out to your regional Illinois Department of Public Health infection preventionist with any questions or concerns you may have in completing the ICAR tool. Consider scheduling the ICAR visits with your regional IDPH infection preventionist when warranted. This might be for a facility in outbreak. This might be a facility that you're very concerned about transmission issues, etc., and that you would like them to go along with you. Or perhaps it's even your very first ICAR. You might ask them to go with you just so that you're comfortable with the process and until as you get familiar with the tool. So get started, learn about your facilities in your county, and good luck.